Hello, my name is Dr. Cheryl Burdette, and I am the director for the clinical component of Origins Incubator. And we talk about case studies every week. And this week, we had a conversation about a patient who has worked with people in the past, has a number of complex presentations, alopecia, microcytic anemia, lichen planus, and she is really trying to figure out how to fit all of this together, and is very specific that she wants to work with someone who can tell her what the cause is. And so the conversation was around, is she right for a membership-based approach? And so initially, the physician that was working with her was thinking, I'm not sure, because if she really wants to know what is the root cause, is that something that I'm able to deliver on? And is that appropriate for a membership-based practice? And to me, it's an overwhelming, resounding yes. This is exactly the kind of patient that we want to work with, that has these layers, things that wouldn't have been addressed already. And so when I look at that patient and think about what's going on in terms of lichen planus, we know that that can be associated with, for example, other autoimmune conditions. She also has autoimmune thyroiditis or Hashimoto's. And so as we began to look at this in terms of autoimmune thyroiditis, that can be associated with alopecia. It can also be associated with lichen planus. So, okay, then what are the next steps? And so we talked about how even though she's had some lab work done in the past, what are the parameters for when we want to redo that? And so she's done that outside of 3 months, really thinking about, okay, let's repeat that and still start with the basics. This is one of the things that we talk about in our approach to the patient from a functional medicine perspective, is how do you work in treating everything, but keeping, compliance where it needs to be and cost where it needs to be. So even though she might have had an ANA in the past, even though she might have had thyroid antibodies in the past, we need to look at those. A couple of other basic markers we'd be interested in to start with. The functional assessment would look at CRP, which can be elevated in lichen planus, and also things like vitamin D. If that's low, of course, we know that our Treg cells won't function as much, and that can be indicative of autoimmunity as well. And so then, okay, so how do we approach this patient? So from there, we discussed, still start with the basics, see where she's at. And then from there, when she's searching for that root cause, I feel that is very deliverable, because when we look at what's going on, it's likely that there's a pattern of gut-based inflammation. And as we start in the gut, we're going to understand what is driving her towards autoimmunity, probably starting with something like a stool test, and maybe also things that would measure lipopolysaccharides. So why? Well, in a stool test, if we have low diversity, we're more likely to be on that autoimmune continuum. When we look at certain short-chain fatty acids, that makes us more likely to have autoimmunity. When we think about panels that would have lipopolysaccharides, even adding on a zonulin, zonulin goes up before the onset of autoimmunity because those tight junctions open. And when you go to the literature, it's associated with lichen planus. It's associated with autoimmune thyroiditis. And so right off the bat, we are thinking of why a leaky gut is a unifying theory for what's going on. Now, the alopecia associated with microcytic anemia. Well, if there's more inflammation, it's going to be harder to absorb iron. So all of these things build on themselves. But even though they're all there, we don't have to address it all at once. And we look at these gut-based studies, we look at a stool test, we look at LPS that upregulates toll-like receptors that just cause the immune system to ramp, as in autoimmunity. This LPS that downregulates Treg cells that shuts off autoimmunity. And we begin to pull the story together for the patient. So then we start there looking at things like LPS, zonulin, stool testing. From there, we see how the patient responds. We decide if, based on the history, if immediately we think we should add a food sensitivity as well. we do our gut-based approach, we see where the patient gets, and then we think about other pieces that might be a part of our story. Is there a stress component that needs to be addressed? Did any of this get worse postmenopausally? These are kind of questions that lead us to decide, okay, yep, then we're going to add on more hormone profile. Or were these things that got worse after a certain exposure? Do we know that she's around anything? Because toxic burst can cause the immune system to be overly excited as well. We'll prioritize those and then either work on hormones next and then detox, or vice versa, based on the patient's history. And so we see, if we're thinking about a 5-visit membership model, actually how perfectly this person slots in. Now, that last part of how do we get to what she wants, which is understanding what the root cause is. We have 2 objectives here. And the first is to help her understand that gut is a likely part of that and explain that piece of it so that she understands root causes being addressed. And the second part is getting her to understand that most conditions are multifactorial. So when a patient is looking for a one bullet, one solution kind of piece, this is where we need to step in and explain to them, you know what? You are not just one pathway. You are not just one infection. You are not just one organ. And so that reductionist perspective that's looking for only one reason why this would be the case is exactly why you failed in the past. And that is why, in terms of the membership, we're able to spend the time working on that gut-based inflammation that contributes, working on that toxicity that likely contributes, thinking about hormones that might be creating more inflammation as well, and being able to pull the whole thing together so that ultimately the patient understands, has realistic expectations, and is served well by exactly what's being offered.